Here's Dr. Jan Mensink with answers to your common medical questions.
What do you do if you think you've got lupus? It's a common complaint that we have patients coming in and have been looking on the web, or they think that they've got lupus, and they come in and they want to know. First of all, there's several things you need to know about the rheumatological diseases, of which lupus is one of them. All these diseases, they are a symptom complex, series of symptoms, and there's what we call points, or different things that qualify for the diagnosis. And you may have to have 5 out of the 10 or whatever. The second thing that's important when you think you've got lupus, and I see this so often, the patients will go to a doctor and they'll get what's called an ANA. It's a blood test that's always positive in lupus. The doctor will run this test and these patients get told that they've got lupus. In fact, more than half of the patients that come to see me and I'm concerned they've got lupus don't have lupus at all. You see, there's what's called false negatives or other things that cause that test to become positive. The second thing that's important with lupus, if you get lupus, I tell people it's a diagnosis that makes doctors look bad. And here's the reason why. It takes about 2 years for the blood test to become positive to diagnose it and say, yes, you've really got it, with this symptom complex. The same thing happens with rheumatoid arthritis. You can have rheumatoid arthritis symptoms, and we know it's going to be probably rheumatoid, but your tests are negative. And then 2 years later, finally, the typical story is you get fed up and finally go to another doctor and he does a test, and all of a sudden your rheumatoid arthritis tests are all positive. 2 years ago they were normal. That's a normal progression of the diagnosis of the disease that happens. So what do you do if you think you've got lupus? First of all, see a doctor who is comfortable and knows about these diagnoses. Number 2, there's a bunch of things that have to happen if the diagnosis is correct. The first thing that occurs is that there's a large group of patients that we may suspect they have lupus, but we haven't diagnosed yet. And then there's those that we know that have lupus. Those that we suspect have lupus, we tend to treat what we call symptomatically with medicines and different treatments that help with the symptoms themselves. Those that have lupus, you need to be looked at and treated by your doctors with a group of medicines that we call antimetabolites and immune suppressant medicines. Because remember, lupus is really your body having an allergy against yourself. And that has to be corrected long term. So the first thing that has to happen is make sure the diagnosis is correct. Most people who come to the office, more than half, really don't have lupus. And they've had a test that is abnormal, but lots of other things will do it. So don't panic if you think you've got lupus.